Okay, joining me now is Vinay Lakra, from the Associate Professor at the Royal Australian New Zealand College of Psychiatrists. Welcome, Vinay. Thank you for your time. What are the concerns from the medical community about the legalisation of marijuana?
Thank you. Nice to be here. Well, I think we know that substance use is a significant health issue. So it's a health and medical issue, and we know that there are a lot of people who do not access help and treatment because of stigma associated with substance use. So the key message really is that those who are using substances, they should be able to access help for treatment. And the other message is about having education campaigns to inform people, especially young people, the harms which are associated with substance use, including cannabis.
Okay, is there a direct link in your line of work and the people whom you represent? Is there a direct link between heavy cannabis use and psychosis or mental health episodes?
Certainly, there is evidence around use of cannabis. The earlier it is used, the amount it is used, and the impact of it in a number of people. Obviously, heavier use can lead to development of psychosis. It also leads to persistence or maintenance of those symptoms if they continue to use cannabis. And so that's why it's important from a health policy perspective that there is education campaign to prevent people or to delay using cannabis, because it has impact on their brain in terms of the development of the brain, but also simultaneously have enough resources to provide access and help for treatment to those who are using those substances, so that not only they stop using that substances, but they do not experience the more severe outcomes in terms of the impact of those substances.
Yes, it's a very vexed question, I have to say. I was talking about it with my parents today, because a lot of people will say that alcohol causes a lot of problems as well. Marijuana doesn't generally deliver violent responses in people who overconsume it on a single occasion. But there has been a growing mental health epidemic that I think has to be linked to drugs, not just marijuana, but drugs more specifically. And that's what concerns me if we open the door to another substance that is legal and perhaps endorsed by the community in this manner. Would you agree with that?
That's a very good question. Look, I think there is, of course, community debate, and there is diversity of views and opinions about this issue. Decriminalization of substance use is slightly different than legislation of substance use. So we're not saying that people should use substances. What decriminalization means is that those people who are using substances, instead of pushing them towards the criminal justice system and applying penalties to them, we should move them towards a system of seeking help for the health problems. And there is evidence, in Australia, quite a bit of amount of money, I think 60 to 80% money is spent on the criminal justice system, and a lot less money is spent on providing services to people who are using substances. So the message really would be that we should look at decriminalizing substance use and encourage people to seek help. As I said earlier, stigma remains one of the most important factors which doesn't allow people to seek help. The examples you gave from United States, where some of those individuals were heavy users of substances, I do not know the circumstances of those individuals, but quite likely that if there were appropriate access to services available for them, they might have been able to get help for their problem or substance use. So I think there are two separate elements here. One is ensuring that we are investing in health services, and one of the things which we're very pleased, certainly in the Royal Commission in Victoria, that they want to invest further in provision of addiction services to our patients, and certainly that needs to happen across the board. So the important point is that you do these things simultaneously. Not only you continue to educate the young people about the dangers and harms associated with substance use, but simultaneously you also try and see that people can actually seek help for their problems rather than delay seeking help, because we all know that if you delay seeking help, that is going to lead to bad outcomes, and you're likely to fare poorly in a longer period of time.
Yeah, that's very true. There is a stigma attached to people seeking help for some things, but in the event that someone you know or you love is doing something wrong, it is most important that they seek help before it gets worse. Vinay, before I let you go, I'm hoping to be joined by by Michael Balderstone from the pro-marijuana group. They had or political party, they had a very good result from their point of view, particularly in the Queensland Senate, but right across Australia. 5.2% primary in the Senate in Queensland, the same votes as Clive Palmer, as you heard. Is this because more people are smoking marijuana, do you think, or do you just sense that it's an osmosis from what's happening around the world where marijuana has been legalised or decriminalised, they understand the difference, and they think it's time that it happens here?
So I think there is obviously some data around the use of various substances, including cannabis, over a period of time. The Australian Institute of Health Welfare does some surveys, and so that data is available to us. It hasn't necessarily increased quite significantly in terms of that substance use. But I think there are jurisdictions across the world. Portugal is one of the countries where they decriminalized substances, and what they found was that the health outcomes got better, and number of other social indices actually got better. So I don't know what the thinking is there in the minds of the community, but I think what I can certainly see is that there are a lot of people in the country who are concerned about more focus on criminal element of substance use, and probably want us to do more in terms of diverting people to seek help for their health problems. Substance use as an illness which requires a biopsychosocial approach to that treatment, rather than push towards criminal justice system. So I'd probably, of course there are diverse opinions, as I said, but certainly the message I would take from that is that there are more people who are wanting us to see substance use as an illness or a health problem, and that we need to do more to make sure that those people who are experiencing those issues, that they seek help, and simultaneously also those education campaigns focused on young people, and that there are adverse impacts of using substances, and we should help them because there are a lot of pressures on them, experimentation, peer pressure, and whatnot. So it's important to understand those issues and focus the public policy or health campaign around prevention of that, and those who are using substances, to make sure that they can access help which is appropriate for them, so that they go on to live their better lives rather than go into the criminal justice system.
Vinay, Lakra, I know many people will be nodding along with you, particularly the parents at home who understand all about peer group pressure and how it affects young lives. Thank you for joining me on Bernardi tonight. And for you at home, I was hoping to have Michael Balderstone. He'd agreed to come on the show. There's obviously been a technical glitch because we wanted to get his side of the story as well. I'm genuinely interested in this debate about whether it's good or bad for the country and why they're doing so well, the pro-marijuana people. So maybe you can share your thoughts with me. We can have a chat about it next week.